Hello, my name is Dr. Brian Monahan, the attending physician of the United States Congress. I would like to speak with you today regarding an update on the novel 2019 coronavirus, SARS-CoV-2, as of April 8, 2020. The situation is extremely serious and requires your urgent attention to contribute your personal best efforts to CDC social distancing guidelines. There has been continued increase in the count of total United States cases, now approaching greater than 400,000, and an increase in the number of deaths, now greater than 13,000. All 50 states have disease activity. There are many American cities, such as New York City, Detroit, and New Orleans, which are called hotspots for disease activity in the United States at this time. There are also many rural areas where the healthcare system has been completely overwhelmed by cases of COVID-19. Previously, the President warned us to expect between 100,000 and 240,000 deaths in the United States, but the current forecasts reflect impact of the social distancing measures, and the total American deaths are now estimated to be approximately 60,000 through the 1st of August, of course presuming social distancing measures are maintained through the end of May. Testing for coronavirus in the United States remains highly problematic. Despite the announcement of a rapid test capability by Abbott Diagnostics, most areas of the United States are subject to allocation of limited tests, in addition to other factors that limit test availability. The severe lack of personal protective equipment for healthcare providers acquiring patient specimens also limits the availability of testing. In our Washington, D.C. area, there is up to a 10-day delay in reporting results when utilizing the national laboratory vendor. Most patients will not have access to a test, and there is approximately 100,000 specimen backlog awaiting testing at our national laboratory vendor. Most individuals do not require a coronavirus test nor a visit to their doctor's office if their symptoms are mild. My present testing strategy is discussed elsewhere on the OAP website. You should be aware that many states are now reporting the demographics of cases and deaths divided by the race of the patient. You should not be surprised to see disparities in healthcare in America are magnified and laid bare by this pandemic. It is important that you recognize that this COVID-19 coronavirus infection is nothing like the experience of influenza. COVID-19 is highly contagious. It has a very long incubation time, and it has a high hospitalization rate. It has a 10 times or greater case fatality rate compared to influenza. No one is immune, not even partially. The very wide range of severity of illness is increasingly being appreciated, including the people who have virus with no symptoms, those who shed virus for a day or two before they develop symptoms, and those with mild illnesses at home, those with shortness of breath and pneumonia illnesses in the hospital, and approximately 5% of people who require mechanical ventilation and intensive care unit support. Approximately half of those who require ventilator use in the intensive care unit will not survive. The situation for hospitals and for healthcare workers is dire. The overall case fatality rate of approximately 2.4% of this pandemic illness has not been precisely determined. There are many factors such as age and pre-existing medical conditions that influence the outcome of people with infection. A precise characterization of the fatality risk would require knowledge of the amount of infection present in the entire population, which is not known today. In the next several months, blood testing for a serology test will be informative as to the amount of disease present in our population and perhaps indicate those who may be immune to infection. We are beginning to see additional features of the infection other than fever, stuffy nose, sore muscles, joints, cough, and chills that also include headache, diarrhea, loss of the ability to smell, and loss of the ability to taste food. There are also rare situations of neurologic and cardiovascular problems. Presently, in our Maryland, Virginia, and Washington, D.C. region, there are greater than 11,000 cases and 230 people have died. This represents at least 5,600 cases in Maryland, 3,700 cases in Virginia, and 1,500 cases in the District of Columbia. The mayor of the District of Columbia estimates that the district has not yet experienced its peak of cases or deaths. I cannot emphasize enough to you how important it is to follow the instructions with regard to social distancing. This will need to be maintained for a long time as our only effective tool to lessen the severity of this disease in the United States. It is likely in the future some aspects of our daily life may become more normal, but the present limitations and sacrifices we are now experiencing will be with us in some form until an effective vaccine is available in perhaps 18 to 24 months from now. All elective travel is discouraged at this time to limit the spread of disease. There are special instructions for travelers from the New York metropolitan area that require a 14-day quarantine when they arrive at their destination, should they move out of the New York City area. Many states have requested a shelter-in-place or safer-at-home instruction for their citizens that sometimes include a prohibition on gatherings of any size. Please consult with your state governor's order to learn of additional limitations when individuals may leave their home under infrequent and specific circumstances only. On the matter of face coverings, many people have had questions. The face covering is often used to limit your ability to spread disease by spreading droplets from your nose or mouth during a cough, sneeze, or when speaking that contain virus. The purpose of an individual wearing a face covering is not to protect themselves from getting the infection, but rather to protect others in their environment from being exposed to the virus that may leave their mouth or nose. The Centers for Disease Control has modified their instructions for voluntary compliance by all Americans to wear a face covering anytime they are outside or in public and cannot maintain the 6-foot social distancing standard. You do not need to wear a face covering if you are alone in your workplace or if you maintain the 6-foot separation between people. You do not need to wear a face covering in your home. There is significant concern that should people adopt the use of wearing face coverings, they will not be adherent to the social distancing requirements that are absolutely essential to maintain at this time, or that perhaps this requirement may deplete masks for medical treatment facilities that are already in desperate short supply. At the Capitol, face cover wearing is a voluntary activity in conjunction with CDC guidelines. If you can maintain the 6-foot separation between people required by guidelines, you do not need to wear a face cover. If you cannot maintain the guidelines, you should wear a face cover. You do not need to wear a face cover in your home. Should surgical masks be available as specified in my recent video, you may wear a surgical mask. Under no circumstances should you wear an N95 mask, as these are reserved for high-risk medical treatment situations. My recent video reviews these types of masks in more detail. Thank you for your attention.